The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Is DeGeorge's syndrome and 22q deletion are they common with autism? I was told that they are and that there is no cure. It is also common to misdiagnose. This is where we're at. My son is getting tested. There are 5 levels of testing with chromosomes. We're on level 2, very nervous.
Yeah. This is a good thing in that we're starting to, there's a lot more testing done on chromosomes to identify the genetic disorders that have symptoms that resemble or are identical to autism. So what we're finding is that you have this title called autism spectrum disorders, and within it there are genetic disorders that have already been identified, and there are more and more as time goes on, people are identifying these genetic disorders. Now, because what happens is, typically autism is diagnosed based on symptoms. So it's not a typical thing to do when you have a child who's diagnosed with autism to go and check their chromosomes. I'm very happy now that there are people who are starting to actually do a lot more genetic testing because it has become so easy to check.
So much easier.
Right? Now, a lot of people have started with just things like 23andMe, but realistically, you could also there's an organization that we're talking to called Linus Bio, and they don't even do a buccal swab, which is, like the 23andMe, I think, is spit.
Yeah.
And what they're doing is they're analyzing the spit inside your mouth, which is fine as well. Others, or maybe 23andMe is blood. I don't remember which one is it.
No, it's spit.
It's spit. So there's obviously there's tests that can be done for metabolic disorders, genetic disorders with a finger prick, which is awesome. Linus Bio also does it based on a hair strand.
Love that.
Which is really good because they're looking at older stuff in the body as well. When you look at hair follicles may hold on to things. But it is entirely possible and I know it's a process, but keep going. And don't look at it as if he has this chromosomal difference, that means we can never teach him to adjust his behavior, or that means that it is what it is. It's not. A lot of chromosomal issues exist, but the child can still learn and can still adapt and can still thrive. So don't think of, just like I tell parents, don't think of the diagnosis of autism as it is, and for the rest of his life he's going to be this way. That's not true. It's a diagnosis, and you can also teach this individual a lot of things that are going to help them thrive. Same thing with chromosomal issues.
There we go. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.